All right, so welcome to today's webinar, Cultivating Mental Health, the community health workers' role with agricultural workers. I'm not sure why this is here. All right. So on our agenda today, we are going to go ahead and be doing some brief introductions, going over our objectives. We will be doing a fun dinámica or icebreaker, as we usually do here at MHP Salud. And we'll be talking about migrant and seasonal agricultural workers and mental health, as well as things like cultural consideration. Of course, the CHW role. We'll be sharing some resources with you before we conclude. And if at any point you have any questions or any comments or information you'd like to share, please feel free to do so. You can always go ahead and do that either through the chat or by unmuting yourself, whichever you feel most comfortable with. My name is Floyd Robertson. I'm a health strategy specialist with MHP Salud, and I am joined today by my colleague, Monica Calderon, who is also a health strategy specialist, and we'll both be talking to you throughout the webinar. So a little bit about our organization. Not sure how familiar you are with MHP Salud, but we are a HRSA-funded national training and technical assistance partner. So what this means is we're able to provide training and technical assistance to federally qualified health centers and other organizations looking to build or enhance community health worker programs. We actually celebrated our 40th anniversary last year, so we're very excited about that. And we are a national nonprofit organization. We have CHW programs ourselves located in Texas and in Florida currently. And these programs focus on providing peer health education, increasing access to health resources, and obviously bringing community members closer. Within the last 5 years, we've provided more than 1,500 hours of technical assistance to organizations with CHW programs across the nation. Our mission is that we want to serve communities by embracing the strengths and experiences of individuals and families, engaging them to achieve health and well-being. We believe everyone deserves to live healthy and resilient lives within their community. And since 2017, we've connected with over 200,000 individuals through outreach and served more than 25,000 through our health outcome programs. So, a bit of what we hope to accomplish today. We want participants, you all, to gain knowledge on the mental health needs of agricultural workers, as well as understanding the impact of community health workers in addressing these needs within their agricultural communities. You will also hopefully be able to identify factors that can affect agricultural workers' mental health and learn a little bit more on how to address them. Agricultural workers face a multitude of challenges on a regular basis that can definitely affect their mental health, right? So CHWs are very uniquely positioned to educate their communities and help address their needs. We'll explore the role of the CHWs, including possible barriers and other factors that can come into play. So with that said, let's go ahead and have a little bit of a fun time before we get into all this information. And I'll pass it over to Monica Calderon.
Hello, everyone. Welcome. And today's Dinámica is reflecting on self-care. So we all know how important it is self-care can be for us. Being that it is a Friday, I wanted to give this little reminder that it is okay to make time for yourself and plan out something special for you to enjoy and give back a little bit of that time that you so much will deserve. So this little dinámica that I have for you today is just to give you some ideas of what you can engage in for self-care. You could scan the QR code. I also dropped the link in the chat box. And so basically the dinámica is to go ahead and spin the wheel. If you could go ahead and press it, Flo, just to give a little example. And then so for me, it would be watch my favorite movie. So some time for myself, maybe spend with my loved ones and or by myself to give myself a little alone time could also work. So if you've already spun the wheel or would like for us to do it for you, just let me know and I can go ahead and give you some other ideas for self-care. So if you were able to access the QR code and spin the wheel, just drop in the chat box or unmute yourself and share what your activity was.
We have Cynthia in the chat that shared that she got listen to your favorite music really loud. I love doing that on a long drive, even a short one works out for sure. Zoe shared that she got order in dinner. We do not cook on Friday, Zoe. We need to dash it, figure it out, paper plates. There's no dishes in the sink on Friday. Sharon shared, scream into a pillow. Hey, that can be very therapeutic, especially if you have comfy pillows. So I love that, love that. Okay, would any, Maria Isabel shared, call a family member is your favorite. Very sweet. I love calling family members, going ahead and getting a little bit of a sweet conversation going. And also, you know, who knows, sharing some family chisme. You never know what new family lore you're going to learn. Juan shared, call a friend you haven't talked to in a while. That's always good. You never know what they've been up to, and those reconnections can end up on some fun plans. Awesome. So love that everyone has gone ahead and shared and tried it out. It's always good when you don't really know what to do. It's Friday afternoon. Let's make some plans for the weekend. I love this. Thank you, Monica.
Thank you all.
All right. So before we get started and really getting into the nitty-gritty of all of the information that we have today, I'd like to go ahead and get to know you all a little bit more. So I'm going to launch a poll here on screen. And what I'd like to know is, does your organization offer mental health services to your community? If you could go ahead and answer yes, no, I don't know. And just to kind of get an idea of where we stand. All right. We have a couple, we have one no, we have a couple of yeses. Some are not sure. Okay. Okay. So the majority of you do have those mental health services within your community, and we have some that don't know or are unsure. Right. Now, the reason I like to ask that is just to go ahead and gauge where your organization stands and maybe what kind of resources would be helpful to you all. So to the point here, we have migrant and seasonal agricultural workers. There's an estimated 4 to 4.5 million agricultural workers in the United States. Now, what is a migratory agricultural worker? They're often called migrant farm workers, and they're defined by Section 330G of the Public Health Services Act as an individual whose principal employment is in agriculture on a seasonal basis, and who establishes for the purpose of such employment a temporary abode. So HRSA, or the Health Resources and Services Administration, define agricultural workers as pretty similar to the Public Health Service Act, but mainly that they do not meet the definition of a migratory agricultural worker. Some agricultural workers are a little bit more, they go ahead and stay in an area for a longer period of time, whereas others move a lot more regularly. Now, generally, migratory and seasonal farm workers are hired laborers who are paid by the piecework or by the hour or even on a daily basis. Health centers serve nearly 1 million migrant and seasonal agricultural workers and their families every year. That's a huge number of people to consider. And of course, we want to go ahead and take into consideration their mental health needs. MSAWs, or migrant seasonal agricultural workers, often face unique challenges related to their living and working environments. And some, you know, are common sense in the sense that, you know, obviously there's economic, social, and educational factors, but things like hazardous work environments, right? Poverty and insufficient support systems. They might be away from family. They might have all their family there, but they don't have the support system that they might have back home. Inadequate and unsafe housing. Sometimes they don't really have a lot of choice when it comes to the type of housing that they're able to choose, right? Inadequate healthcare access. If they're in a very isolated location, or the area that they're in has only 1 or 2 health centers or clinics, that access is very limited. Continuity of care. They might have gotten a diagnoses back home that they're unable to follow their care plan with, because they're having to move around on such a frequent basis. They don't get to establish that rapport and obviously the stable care plan with their healthcare provider. We also have lack of insurance. Now this varies, but unfortunately, a lot of times they don't have a health insurance, or they don't have the ability to get one, or to figure out the different options that might be available to someone who's not a agricultural worker. Then we have cultural and language barriers. And we know this goes beyond, oh, do you speak Spanish? Because that's definitely not a blanket skill that can go ahead and cover these barriers. Sometimes they speak different other languages. They might be coming from different areas of Latin America. They might be coming from, they might be speaking indigenous languages. It just varies. And sometimes it can be very difficult, not only, of course, to find native speakers to help them out, but also to just find translation services or material in languages that they'll go ahead and understand. And then, of course, we have the fear of using services due to immigration status. Now, this varies, but a lot of times some of them might feel, you know what, if I use services, they're not going to renew my permit. If I go ahead and reach out, they're going to go ahead and look down on me or turn me away, and or call border law enforcement, whoever it is. And then we have lack of transportation. Again, depending on their housing situation, it can be very difficult for them to get to and from wherever the healthcare service is, right? So some additional risk factors, right? We talked about how common it is for MSAWs to live under these challenging circumstances. And again, it can make it can seem like a lot of common sense, like, of course it would affect their physical health, if they're unable to access health services. But we also have to think about the mental and emotional well-being, right? When we think about their living conditions, living in rural or remote locations like migrant camps or temporary housing can have a definite detrimental effect. We have the aspect of moving to the US or migrating to the US without family. That social isolation takes a huge toll on someone's emotional and mental health. And let's say they did bring their family along, or maybe they established a family here. Trying to raise a family in migrant camps or while working in the fields when they're doing 12, 14, 16-hour shifts can be extremely difficult, and definitely challenging, not just for the fact that you're bone tired at the end of the day, but your mental and emotional well-being is definitely also affected. So in one of our reports, we found there's some identified issues unique to mental health, the mental health needs of the migrant and seasonal agricultural workers. We have, based on this study that we did in 2021, identified issues with depression at a 98.6%, general anxiety disorder at a 85.1%, substance abuse is a big one too, and post-traumatic stress disorder. So when we look at these diagnoses and we're starting to think about who it is affecting, where that number is coming from, we also have to think about the subpopulations. We have women at the highest percentage here at 89.2%. And we see that huge shift, that big difference between the women at 89.2% and the men at 63.5%. So that difference in the reported mental health issues, why do you think that is? So who's usually taking the kids to the doctor appointments? Yeah. Oh, Erin shared here gender stereotypes. Cynthia shared stigma, higher with men. Yeah. It depends on who is seeking support. If who's the parent that's taking the kids to their regular checkup. Women are more likely to go ahead and go and do their regular checkup with their OBGYN, fill out those questionnaires that they give you. So there's a lot of different aspects of that that we can go ahead and take into consideration. Definitely stigma is one of them, having stereotypes of, well, those things don't affect me. That's a woman thing. That doesn't affect me at all, right? So there's definitely, it could be due to that increased stigma among male MSAWs, and it could also be just, it might be easier for the women to be going to get those healthcare services versus the man who might be doing 12, 16-hour shifts. And that's a bigger loss of income if they have to take the day to go get their checkup, get screened. Sharon shared, women are more open than men, and women have the responsibility of managing the household. Right, there's a different amount of stressors and different kind of stressors for both of these subpopulations. So these mental health issues, including what we mentioned, like the depression, anxiety disorder, substance abuse, PTSD, they're all influenced by the cumulative effect of constant relocation, social isolation, poverty, and stress. And these are just to name a couple. Now I'm going to go ahead and share another poll that I'd love for you all to answer. And think about the factors that we just mentioned. We talked about poverty, we talked about social isolation, we talked about language barriers, cultural considerations. And when we think about these mentioned factors, or maybe others you might consider, do you think that which of these do you think affect the mental health of agricultural workers in your community the most? If you had to pick the number one stressor, the number one cause, which one of these would you pick? Lack of insurance, okay. Cultural and language barriers, yes. Inadequate and unsafe housing, that's a big one, yes. Okay. So we have here cultural and language barriers as the highest ones, and I'm glad you all took note on that, because that's one of the biggest things that CHWs can go ahead and have an effect on. So as we move forward, I'd like for us to also talk about what barriers are there besides the fact that they already have additional challenges, that they're already in a hard spot to go ahead and get that assistance or access to those services. We also have to take into consideration some of these additional barriers, right? In the findings of the Department of Labor of 2015-2016 National Agricultural Worker Survey, they reported that only 47% of MSAWs have any form of health insurance and coverage. So some of you answered that as your number one reason or number one challenge. We also have other common barriers like a concern about losing paid work time. A lot of times it's not like their employment includes, you get 3 weeks of paid time off and you get sick days. And unfortunately, that's not usually the case, right? So if they're the primary provider of their household expenses and they're the caregiver, losing a whole day worth of work, it can be the difference of being able to pay a bill or not. It can be the difference of being able to buy groceries for that week or not. Some of you previously mentioned mental health stigma. They might be scared of what What are the people going to say? You know, ¿qué va a decir la gente? Who's going to find out? Are they going to look at me differently? Lack of transportation is definitely a big one, especially in rural areas. How are they going to go ahead and get to and from? And we also touched on the fear of using these services due to immigration status, and also the lack of knowledge of mental health services. In a lot of different communities, mental health is a very taboo subject. It is not something that many are encouraged to participate in or to acknowledge as even a real thing. I've heard from different members of community, oh, that's eso es chiflazón, right? Those are just made up things that new age generations have come up with. Whereas we know, mental health is part of your overall health, period. So those are some of the things to consider when we're thinking about how to reach these communities, how to communicate with them, and how to start the educational process when it comes to mental health services. Because even if you do have them available in your organization, and you say, well, why doesn't anyone come and see our counselor? Why doesn't anyone come and get screened? One, they might be embarrassed. Two, they might not know what you're even screening them for. They might have different names for things like their anxiety or their depression. So those are definitely important considerations. And that's where our cultural considerations come in. Health practices and beliefs such as going to the doctor or having stigma related to mental health can vary depending on where and how someone is raised. As migrant and seasonal agricultural workers migrate to the US, whether it's temporarily or permanently, they bring along their own health practices and beliefs. And obviously, sometimes these differ or look different as they try to navigate the US healthcare system. Now, they might have not even been able to navigate their own country's healthcare system. We have seen and heard from other health centers of cases where, well, how did you used to go to the doctor back in your country? I've never gone to the doctor in my country, or I've never had that available to me. So these are really important things to consider when you, as a health center staff member, think back and say, well, this should be common sense. This should be common knowledge. It's common knowledge or common sense to you. However, it's important to consider where this person is coming from, how they were raised, what their viewpoints are, right? So this is why it's crucial to include culturally informed outreach and patient education to start working on removing some of those barriers that we talked about towards mental health care. Now, before I move forward, does anybody have any questions or any comments they'd like to add? All right. So let's go ahead and talk about stigma. Many of you mentioned it. Oh, Cynthia, here we have a comment. There's a program for agricultural workers and migrant workers, but unfortunately the main source of income for them in that area is dairies, which they don't consider either agricultural or migrant. Right, so the definition of who meets the requirement for these services vary depending on your organization and your area. And I see here that your indigent program requires a social security number for all family members, so many don't qualify. That's another barrier that many don't think about, right? Unfortunately, many migrant workers might receive, I believe they receive some kind of identification number, but it's not a social security number. Monica, correct me if I'm wrong. And a lot of times that can serve as an additional barrier to receiving that care. Sure. So when it comes to stigma, it can be very easy to go ahead and turn around and be like, just get over it. It's not a big deal. Just go and get your services. You need them, just go and do it. But it can be difficult for those who are unfamiliar with MSAW communities to understand the many factors that can affect the mental well-being of the migrant and seasonal agricultural workers. It's really easy to dismiss the stigma as a lack of understanding. However, it can go deeper than that. A culturally appropriate approach is definitely necessary to understand the many challenges they experience. And it's also important to be able to take that into consideration when you're wanting to understand the community's perspective to appropriately provide care and education on topics beyond physiological or physical health. So what is mental health stigma? When someone with a mental health illness or diagnosis is called things like dangerous or crazy or incompetent, rather than just seeing it as they are unwell, this is an example of stigma, right? Whether they're being mocked or called weak for seeking help, it really does involve a lot of inaccurate stereotypes. They might be characterized as being more violent than the rest of society, or maybe someone with anxiety may be labeled as being cowardly rather than having an illness. People with depression are often told to just snap out of it, stop being sad, go outside, mow the lawn, you'll get over it. But that's definitely a lot of misconceptions, right? So it attaches these labels to certain diagnoses, and it discourages community members from reporting any mental health concern. They don't want that label. They don't want people to talk about them in that way. So MSAWs are no strangers to this stigma, and it can definitely affect how receptive they are to discussions about mental health. So why does stigma exist? It can arise from ignorance and misinformation, just a general lack of understanding of mental illness, but also just because some people do have negative attitudes or beliefs toward it. There's a prejudice against mental health, and this can lead to discrimination against people with mental illnesses. Even some mental health professionals who are educated in these topics have negative beliefs about the people that they care for. And media, as helpful as it can also play a part in reinforcing that stigma by portraying inaccurate stereotypes about people with mental illnesses. They can sensationalize these situations through unwarranted references, even things like using demeaning or hostile language. So, for example, if a part of the media associates mental illness with violence, it promotes the myth that, oh, everyone with a mental illness is dangerous, right? So in fact, research shows that people with mental illness are more likely to be victims rather than perpetrators of violence. So if you are someone who just received a diagnosis, a mental health diagnosis, how scary is that to know all these different labels that are going to go ahead and be attached? Who are you going to be able to talk about your new diagnosis, your care plan, your needs? So dealing with the effects of prejudice and discrimination can be very distressing, and it can definitely make things worse. A lot of people say that that's harder than dealing with the mental illness itself. If you think about it, you don't have to try to defend yourself if you have any other kind of diagnosis. If you say, well, I have diabetes, you don't have to defend that truth. You don't have to defend that fact. Whereas if you say, well, I have a depressive disorder, you're more likely to be told to snap out of it, to find other activities, to just not be sad, right? So in some cultures, there's a built-in stigma already against these mental health issues. And it can make it really difficult for someone within those communities to seek and get help because they don't want to be shamed. They don't want to be labeled. So there's different barriers that can go ahead and take those things into consideration. But all of these things that we talked about are really important because when we think about, okay, so what do we do now? This is all dark and gloomy, and what can I do now? What can I do about it? That's where your community health worker comes in. Now I'm going to go ahead and let Monica Calderon go ahead and talk a little bit more about the community health worker role and the community health worker profession. But if at any point you have any comments or questions, please feel free to share them in the chat, and I'll be looking at it and making sure I answer.
Thank you, Flor. And so as we've gone over all those issues and challenges that sometimes impact the communities, especially relating to migrant seasonal agricultural workers, we want to think about how we can make a difference in increasing better health outcomes, better quality of life. And this is where, as Flor mentioned, we bring into play the community health worker. I myself am a community health worker. I've been a community health worker for 10 years and growing strong. So when we think of a community health worker, I'm going to go ahead and share the definition that's shared by the American Public Health Association, right? So the overall definition of a CHW or a community health worker is that we are frontline public health workers. We're trusted members of our communities who have an unusually close understanding of the community and the individuals that we serve. So this in turn helps us build trusting relationships. It enables us to work and serve not only as a peer, but as a liaison, a link, an advocate between the health and social services within our community. It helps us gain access and facilitate a deeper connection to the communities that we're serving and improve the quality of the overall services that they're receiving. And we take a culturally appropriate approach. So CHWs go beyond just providing services. We help build individual and community capacity by increasing health knowledge and self-sufficiency through different activities. But overall, it begins by building trust in the communities that we have. That enables us to be able to outreach, to go ahead and provide community education, informal counseling, social support, and gain the trust to be able to advocate for the populations that we're serving. So in this case, we want to think about who we have in our health centers that might be playing these roles, or maybe you yourself are engaged in community health worker work and profession. Maybe you're not familiar with them. Are you aware of any other names that community health workers might be recognized or also acknowledged as? If you'd like to drop it in the chat box, or you can unmute yourself and share. And I ask this because sometimes we might have CHWs within our health centers and we're not aware that that's the work that they're doing or that's their role. So just to give an idea, sometimes community health workers are also known as promotoras de salud, health coaches, lay health advisors, community health representatives. Sometimes they're also known as peer mentors, peer navigators. Anyone else like to share anything that they might know that the community health worker might be known as, or if you have an idea, feel free to share. Outreach specialist, absolutely, Juan. Promotoras, health educators, care coordinators. Yes, absolutely. And so CHWs also belong to different types of roles within an organization or a health center. Certified CHW, absolutely. And so we know that they can be integrated into healthcare settings, or they can go out in the field. And that's where they take that grassroots approach to talking to the community. If we could move on to the next slide, please. And so what makes a CHW able to be able to connect to the communities? So the community health workers have skills and qualities that enable them to be able to connect to their communities. One of the things that also sets a community health worker apart is that they're usually from their communities. They have maybe lived there, grown up there, moved there, have known and are familiar with the language, the culture, And so this enables them to use the skills and the qualities that they have and possess to be able to connect with the individuals within their community. And we see here from the C3 project a breakdown of some of those CHW roles and that help them be able to carry out some of those uh, tasks that they might be working when they're reaching out to the community. So we have cultural mediation among individuals, supporting health and social service systems. They work on providing culturally appropriate education, care coordination, as you all mentioned, providing coaching and social support, advocating for individuals within the community. And again, because they're from the communities that they serve, they're familiar with some of those social and cultural challenges that the communities are facing. And so ideally, the goal is to go ahead and be able to empower the individuals that they're serving by building that trust, drawing out on the strengths of the community. We look at how it provides that support to be able to provide direct service, um, implement and carry out other activities like community assessments, which we know that if a stranger goes into an environment or a community that they're not trusted, they might not be open to share information about some of the challenges or barriers that they're experiencing. So that all comes into play when they're conducting outreach or doing evaluation and research on what are some of the needs that communities might have. We think about that trust that comes from having a shared understanding of what's going on within the community. So we see that the skills that CHWs possess um, have to be strong in areas like communication, showing active listening, being empathetic, um, using that to draw from the conversations that they're having with the community and knowing what needs are that are foremost and important for the individual that they're trying to help so that they can accurately and appropriately provide the services and care coordination they need. So we have a list of skills and qualities that make a community health worker of value to the communities that they're serving, specifically for migrant and seasonal agricultural workers. And we've had also instances where migrant seasonal agricultural workers have become community health workers in themselves and have been able to advocate even further for their communities. So because of these skills and qualities, they establish a deep connection to the community because they have those shared lived experiences. Again, this adds value to what they're trying to accomplish, informing that trust and being able to help the community navigate through some of the social challenges and barriers that they face. Uh, we see how community health workers can make a difference because of that one-to-one approach that they're able to offer the communities and have that opportunity to maybe take that care, access to healthcare and social support services to another level. If we can go on to the next slide, please. So here we highlight more on the CHW cultural connection. Um, Again, CHWs possess an intimate knowledge of the communities that they serve. And so they have that shared identity. It could come through a shared race, ethnicity, education, socioeconomic status, or maybe, again, those lived experiences where they maybe directly have not been able to experience something, but they know maybe of a family member also that has gone through a similar situation that they're able to empathize and relate. So that gives them that advantage of being able to bridge the community to healthcare systems. So one of the other thing is that they are able to navigate the healthcare systems and are knowledgeable of where the resources are in their community or where there is a lack of resources. Again, through the conversations that they have, through drawing out all this information from their healthcare systems where they might be working, the health centers. And so this is where you start seeing that connection. taking the information and knowledge that they have and connecting it to the community to provide them that one-to-one support. It gives them that opportunity to also address any misinformation that might be out there pertaining certain health services. We talked about mental health. So when you're able to talk about how you're feeling with somebody that's not being judgmental, that is listening to why you have a fear of accessing maybe mental health support or health services, and they go ahead and comfort you and let you know that it is okay to feel how you feel. There are services that can help you overcome these situations or challenges or issues that you're facing. And they also walk you through the steps of how to access care or give you a warm referral, which means it goes beyond just giving you a paper referral. It makes a big difference. So it's these human connections, these real connections to the community that make the difference in accessing care and supporting our agricultural workers when we use a community health worker to initiate these actions. I'm not sure if anybody would like to share, but have you been able to see a difference maybe within the communities that you're serving when CHWs get involved? Maybe you can think of a time that you were able to see somebody that had been hesitant to access maybe help with diabetes or getting a referral that actually changed their life because a community health worker was involved. Can you think of any testimonials or experiences like that? Or maybe you yourself have contributed to change like that that you would like to share?
Hi, hello.
No.
My name is Diana Perez. I am the Enabling Services Coordinator here in Central Florida Healthcare. Thank you for the opportunity that you give us to be part of this training seminar. And I'm a CCHW as well. And we've been helping for years our immigrant community in all aspects. And they've been very, very grateful. Number one, because yes, we are trained to help them. We know where to look for the resources. And for us, it's important because when they come to our clinics, they not only come as a patient, but also they look for someone that they can trust and they can lay on and say, you know, I need help. I don't need how to read. I don't need how to write. I don't know where to go. I don't have transportation. I don't know exactly what should I do. So they know that in each clinic that we have a navigator and we have a person that they really can come and know that they are going to leave the clinic with some responses. So thank you for this opportunity.
Thank you, Diana. And those are wonderful examples of what community health workers do out every day when they try to establish these meaningful connections with the communities and the differences that we're able to make. So it's that impact that you share that keeps the work going. So thank you for sharing. Anybody else would like to share? Okay. If we could go on to the next slide. So some CHW culturally responsive strategies. We want to think about all the things that Claude mentioned, those barriers in mental health, access in mental health, health services, some of those issues that might be facing, that they might be facing in their work environments. So how can we help as community health workers? Well, we can definitely help clinicians and other staff acknowledge and understand the different communication styles of migrant seasonal agricultural workers. We want to think about language. We want to think about maybe that cultural aspect that's involved with language and what it means to them when they're trying to communicate with healthcare providers, mental health specialists, or even other social service organizations. So first of all, we want to identify if there's any miscommunication between the client, so that they're not, being labeled as maybe non-compliant. Maybe if they're being supported through healthcare services or mental health services, they might not be open to take on the recommendations that are being given, or health practices or changes that they're being asked to take to maybe improve their diabetes or anything else that they're trying to work on. And so sometimes it's not that they're being resistant towards the healthcare services that they're giving, it's just that it might look differently for them based on culture, or the language is not connecting. And so this is where we want to make sure that they have supportive services like maybe translation, if we're able to be there, or have a certified translator in the healthcare visit, or also if it's something that maybe they don't want to engage in because it doesn't look familiar to them based on cultural practices. So this is some way we can help bridge that understanding between healthcare provider and patient, and our seasonal agricultural workers, so that they can have a connection and be on the same page when they're trying to get support. So we want to think of those effective cross-cultural communication skills that we can support and help reduce any misunderstanding or miscommunication between the provider services and the individuals that are seeking these services. When connecting MSAWs with resources such as telehealth, health centers, mobile clinics, we want to do this thinking about also, does it meet their needs? Are we just referring to refer, or we're looking at the different specific needs that they have? Does the telehealth service offer the support in their language? Does it have interpreter services if they're not? Is it accessible when they are able to access it? We want to think about those things. If we're referring to maybe a mobile clinic, we want to make sure that they know what they need before they get there, so that they don't get discouraged and that they don't want to eventually go back for follow-up, or if they didn't have all the documents that they needed for a health screening or a support, that they didn't go, and not get any access to the services that they were seeking. We know how valuable some of the time is for any of our community members when they make the effort to go seek a service, especially because we mentioned sometimes they don't get paid for maybe taking a sick day leave, or if they go through during their lunch break. A lot of these times, they're sacrificing a lot of their own work time or personal time to be able to get a lot of these services. Or it might be that they finally got encouraged to do so, and because they were not given all the information, they got discouraged. So we want to take that proactive approach and make sure we're giving all the information that will fit their needs. So this is how we promote, health equity among the migrant seasonal agricultural workers. We want to reduce and help reduce any misinformation, contributing to underutilized health and social related resources. So as much accurate information that we have a commitment to provide to the individuals that we are servicing, this will always help them make informed choices. So before they decide they don't want maybe to access a certain health or social services, we want to let them know if they have any uncertainties, that we give them the most reliable response, and if we're not able to, we can connect them to the right person that can answer, especially if it might have any legal or immigration background that they might need to know about. We always want to make sure we give them the most accurate information so they can make those informed decisions. If you could go on to the next slide, please. Other strategies and best practices to address mental health needs. We definitely want to demonstrate empathy and support. We want to listen and acknowledge a person's feelings. We want to let them know that, it's okay to feel how they feel, and let them know that it's okay to access support. Again, we think about all those cultural barriers and stigmas. We want to be able to address that misinformation. So if we have the opportunity to engage in one-on-one discussions and answer questions, take the time to do so. Set aside time when the individual is able to do so. We know sometimes when we're outreaching out, maybe in the fields or providing information out in a more public setting, a lot of hesitation till it still exists. So offering additional supportive opportunities is a great way to address any of those hesitations that they might have to access maybe mental health, and definitely treating our community with respect. So as CHWs, we always try to respect the different cultural practices and beliefs about mental health. And so if we encounter situations where we know that they are sharing that they're afraid to be maybe made fun of or considered that they're not able to function because they have maybe depression, anxiety, we want to let them know that there is help out there and that some of the symptoms that they might be experiencing can be supported through a counselor, or we link them to the appropriate person. So we want to make sure we're, again, knowledgeable of the resources that are in the community, offer opportunities to engage in healthy activities through fun and supportive group activities. So we want to create safe spaces in our communities. Overall, encourage them to engage in self-care, just like we talked about at the beginning. Everybody has the right and opportunity to make time for themselves so they can also disconnect from the day-to-day things that sometimes causes stress. So promoting self-care within the migrant agricultural community is a way to help support, creating these, again, safe spaces, also building up the self-esteem for the individuals that we're working with, and contributing to a healthier community that they can go ahead and feel welcomed and being a part of. Anyone else would like to share maybe a strategy that they are practicing or sharing within their communities that they work with? Something that they support. When we think about healthy activities that we promote, anything that you might be offering or sharing within the community that you've seen that is a really great way to maybe address mental health needs. It could be a form of pláticas, support groups. And it's a great way if you have an opportunity to share right now. This is how you highlight the efforts that you yourselves are taking and making a difference within the communities that you serve. So if you can't think of anything right now, feel free to drop it in the chat and we'll definitely share the efforts that you are definitely engaging in. Next slide, please. CHWs definitely rely on communication. This is a wonderful technique that we have and skill that we use to address mental health concerns. So while there are a lot of techniques like motivational interviewing, we want to start with the most basic, which is basically being an active listener, okay? So we want to focus on what the person is telling us. We want to make sure that when we're engaging with them, we don't interrupt the person when they're talking. We want to let them finish what they're trying to communicate to us, not pressure them into sharing more than what they don't want to, because sometimes some of the things that they might be sharing might be difficult or painful for them as well. So we want to let the person know through our body language, through our eye contact, if it's appropriate, that we are listening. Overall, we want to use reflective listening. And so this is a way we can say back to a person what we think he or she is telling us. And this ensures that we are correctly understanding this. And so while this might seem something so basic can take can go a long way in building trust with the individual that you're working with. Starting off simple is always a great way to connect with your community. Remember, sometimes you might be the only person that they've had someone ask them, how are you doing? How are you feeling? Can I help you? What do you need? And so when somebody finally opens up to give them some type of help, it's like, wow, it can even be overwhelming. You don't know where to start. Sometimes it could even be emotional. So again, providing the space to practice something so simple as good listening can be the start to building that trust and getting through to an individual to be able to make a long-lasting impact. And so I encourage you to start simple, and then you can build on that and definitely make that connection with the individuals that you're working with in your communities. We can go on to the next slide.
Wonderful. Thank you so much, Monica.
Yes.
That was a lot of really great information, and Monica did a great job highlighting the community health worker role, all the many different tasks and skills and qualities, everything that entails the profession. But one of the other aspects that I'd like for you all to think about and to learn more about is the intersection of community health worker role and the services provided and community resilience. So what is community resilience? Community resilience is the ability of a community to prepare for anticipated natural hazards, adapt to changing conditions, and withstand and recover rapidly from disruptions. Now, one of the first things that comes into mind is thinking, oh, there's a community that got hit with a natural disaster. We had the COVID-19 pandemic, all the different issues that came around from that. But we also need to take into consideration the effects of those situations on the mental health of the community themselves, right? How quickly or how much of how affected was a community by, let's say, a hurricane that happened? Maybe some of the people in the community might have lost their home, might have lost loved ones, might have had, damage to some of their property, might have had damage to themselves. There's a lot of different factors that can go ahead and take a huge toll on the mental health of your community members, particularly with migrant and agricultural workers. When you think about all the challenges that they're already facing, some of the stuff we've talked about, like the housing situation, the social isolation, you add things like COVID-19, where social isolation is now multiplied to the max, and there's a lot of misinformation, there's a lot of fear, how much that affected their mental health and the role that CHWs can play in not only addressing the needs and addressing those barriers at that time, but also increasing the resiliency of the community, so that next time something happens, they're better prepared, they're more able to go ahead and bounce back, to go ahead and take whatever changing conditions are going on. So with that said, I'd like to briefly touch on the community resiliency model, or CREM. Now, CREM can be used by anyone, and it can be used for anything, whether it's something like the COVID-19 pandemic, or where it's a natural disaster like a hurricane or a tornado, anything like that. But it can also be for any changing conditions, right? Right now, there's a lot of different situations going on, in border cities and different rural areas that are changing the living conditions, that are changing the services available, that are changing the very makeup of a community, and increasing that resiliency and addressing the community as a whole is essential. And that's where your community health workers can play a huge role. So what is the community resiliency model? The community resiliency model uses observations and knowledge of patterns of the nervous systems to help people learn to distinguish between sensations or feelings of distress and well-being, right? So some common reactions to stress can be things like nightmares, guilt, apathy. Some people just shut it down, right? Some might isolate themselves or become angry at others. There's a lot of different reactions to stress, and it varies depending on the person's character, on cultural considerations, on where they live, who's living around them. There's a lot of different reactions to stress. So the community resiliency model focuses on teaching the community about the different community the resiliency skills, right? We have things like grounding. How many of you have heard of grounding? You can just do a show of hands or on the chat. Okay, yeah, we have some thumbs up here, right? So grounding is when you have direct contact with a surface. And this can be going ahead and saying, you know what, let me go ahead. What do people do when they go ahead and get some bad news, or they get something that's stressing them out? You know what, let me take a seat. I'm going to grab onto my chair and I'm going to just sit down and take a breath. They practice gesturing, intentional movements of expression, whether it's, you know, crying or, you know, holding themselves. Those are all different things that people do to ease their emotions, to go ahead and respond to stress. Resourcing, right? Calling something to mind that calms them down, thinking about their happy place, thinking about something that makes them feel better. Right? So these are the different skills of the community resiliency model that we can go ahead and teach the community themselves, because we want them to stay in that level point. We don't want them to feel, you know, these highs and lows on all their emotions and suffer through these different reactions of stress, of feeling physical pain. You know, when you hear bad news, oh, now my stomach, I'm getting a stomach ache, or I'm getting a headache, or you know, I'm questioning my faith, or I'm questioning my core beliefs. These are all things we really don't want people to have to go through. And in order for them to not do that, we have to increase their resiliency zone of saying, we need to increase how much tolerance they have to the different stressors that come into, or that can affect them in their lives, right? So I just wanted to briefly touch on the community resiliency model and the different skills, because that's a really great way to go ahead and get started on those conversations, not just to talk to them about mental health, but to really increase the resilience and to increase their tolerance for the different stressors, as well as learning more about themselves and taking time to figure out what works for them, right? Some people, when they're stressed out, going outside, putting their feet in the grass, drinking a cup of cold water, something like that helps them out. Whereas others need more socialization. They might want to go ahead and be with their family, with a large group of people. You know, different strokes for different folks, different things work for different people. And teaching them about community resiliency and all these different skills is really crucial in increasing that tolerance and in addressing those mental health needs. So what does the CHWs have to do with it? Obviously, they can provide the education on these things, but by doing so, they also empower community members, right? By saying, hey, it's not just you have to come and talk to me, it's this is what you can do for yourself at home, so that they feel in control and they feel independent and they feel like they can go ahead and take a lead in assessing and addressing their mental health needs, in addressing the stressors that are going on in their lives, and overall making them stronger individuals and more knowledgeable individuals. And at the end of the day, also more aware individuals of what's going on within themselves, what works for them, and how they can best deal with any challenges that they might be facing, right? CHWs, like Monica mentioned, are the bridge between communities and emergency response systems. Teaching them about the services that are available is great, but also telling them, hey, from the moment you start feeling this way, we're going to take steps 1, 2, and 3, and I'm going to be here along the way, is a huge, huge role of the CHWs. At the end of the day, CHWs share their loyalty. They have they're loyal to the community, and they're loyal to the health service systems that are in place. They're able to have a role in mobilizing community members so that they can go ahead and get screened, that they can go ahead and take advantage of preventative, or that first line of defense in mental health services and physical health services, of course. Overall, they help foster a sense of unity and pride within the community. They're able to say, hey, I've helped you, I've educated you, you can do this on your own, you can do this for yourself. And the community as a whole becomes stronger and they all benefit from it. So we wanted to go ahead and share a couple of different resources that we have. We've developed a Salud para Todos guide, where we talk about how CHWs can help by addressing the stigma around mental health, some of the stuff we touched on. And they can also use resources to help people get early care, reduce the negative impacts experienced by the individual, but also experienced by their family and the community as a whole. Now, obviously, we talked about the huge amount of migrant and seasonal agricultural workers in the United States, but if you think about it, there's approximately about 58 million Latinos living in the US. And finding access to mental health care that they can identify with poses a significant challenge, whether it's because they might not speak English or because they want to go ahead and see a Latino mental health care provider. Whatever the case is, it's an additional barrier. So it's really important to address these barriers to lower the risk for anxiety, depression, and substance abuse, often experienced at a higher rate in this community. Now, that's where your CHWs come in. This program manual is for CHWs to strengthen their knowledge about mental health issues, coping mechanisms, and how to utilize resources to help those suffering from mental health issues to access the services available to them in their community. Some mental health resources you can also share with your community are here listed below. There's different helplines. We have the disaster distress helpline, as well as the agri-stress helpline. And these help by providing free and confidential crisis support to agricultural communities. This last one provides it to communities in Connecticut, Missouri, Pennsylvania, Texas, Virginia, and Wyoming. And they're available 24/7. Plus, they have interpretation services as well. Now, based on your responses, based on your feedback on the chat, I see that some of you are already, you already have a CHW program in place within your organization. But for those that don't, or for maybe if you do have a program, but you want to go ahead and get more information and growing it, we have a couple of resources for you as well. We talked a lot about the CHW role in mental health for MSAW communities, and we wanted to go ahead and give you a couple of next steps on what to do if you don't have one or you want to grow one. And we have a collection called the Starting the CHW Program collection of resources. The first of these is a guide to organizational conceptual fitness. This resource helps your organization ensure that they have considered all the structural components necessary to create a CHW program. And we've done this by putting together a series of questions that we've developed from over 35 years of experience. Now, once you've completed that step, we have the program readiness checklist. Obviously, starting any kind of new program within your organization has its own challenges, but it's really important for your organization to ensure that it has the structural components and that has a little checklist to go ahead and make sure they have everything they need to ensure that, if there's any elements that are missing, they can go ahead and work on getting those developed. Now, one of the biggest topics, one of the biggest barriers that we often hear about through these webinars and learning collaboratives is funding. How are we going to pay CHWs? How are we going to sustain these programs? So we will also be sharing this guide to grant opportunities for organizations that are looking to implement CHW programs, and it will help them find funding from a variety of services. We created this guide to inform and support organizations through the funding process. It focused specifically on identifying grant opportunities, resources, and other forms of charitable support, such as individual donors, community events, things like corporate sponsorship, and donated services. Now, these resources are really important, especially between grant cycles and during political and economic turbulence. Obviously, this is an election year, so that's something to also consider and take into conversation when you're talking about starting a new CHW program. And Monica is sharing some of these resources here on the chat, but we will be sharing this slide deck as well as any of the links that we had on here with you in a follow-up email. We also have an upcoming learning opportunity. There's a learning collaborative starting on March 13th. It is focusing on the CHW role in screening for colorectal cancer among MSAW populations, the health disparities in the screening rates, as well as unique barriers and culturally appropriate strategies for promoting colorectal cancer screening, and introducing an evidence-based curriculum that can be used to promote colorectal cancer screening among MSAWs. So with that being said, we're reaching the end of our webinar. We would love to hear about how we did, what your thoughts are, and if you have any kind of feedback for us. Monica just shared the link there to the survey, but I'll also be sharing it in our follow-up email. It takes about 1 to 2 minutes to answer the couple of questions. We love to hear from you, and it helps us inform and shape our future learning opportunities for you. Thank you so much, Marisabel. I appreciate that comment. Now, if at any point you have any questions or you say, you know what, I want a more one-on-one conversation, we would love to hear from you. So please feel free to contact us at the email that you see on screen for any additional questions, or if you have any additional information on how we can help you address your CHW related needs. Thank you all so much for attending today's session. I'm going ahead and stop sharing, and then I'm also going to go ahead and stop our recording. But I appreciate you, all of you, attending our webinar.